Hi, everyone. Super Bowl champ Vernon Davis here from Legal Help Center. If you've been injured in an accident and think you deserve compensation, listen up, because we have legal professionals standing by right now to answer your questions for free. You can find out if you have a case and how much it's potentially worth.
Thanks, Vernon. You heard it, folks. If you've been injured, call and find out how much you qualify for. Call 800-497-4410. Advertisement sponsored by Legal Help Center. May not be available in all states.
And welcome to your favorite Medicare podcast with your favorite Medicare host, Toni King. The podcast is Medicare Moments. Hi, Toni King.
How are you doing, Jim? We're going to have, well, this one's not going to be as much fun, but we're going to teach people what they need to do so they don't make mistakes. Because all you have to do is make a major mistake and it can change your whole Medicare, and it can change all the money coming out of your bank account. We try to keep it in your bank account, right?
We do. And here, Toni, this one's entitled, My Low Income Qualified Me for Medicaid, but... So it goes like this, Toni. It says, Dear Toni, in January, I was diagnosed with lung cancer at the age of 60. A nonprofit cancer program in my state of Texas was able to help me qualify for Medicaid to begin receiving medical treatment since I have a very low income and am uninsured. Right now, I'm not paying anything for my cancer treatments. My chemotherapy will begin next week with the possibility of receiving a lung transplant in the near future. Friends tell me I am crazy not to apply for my Social Security disability since I need the income. Social Security has verified that I am eligible for disability, and the amount I can collect will be over $2,000, which is more monthly income than my state Medicaid program allows. My mother advised me to contact you before I sign up for Social Security disability and ask what I should do. If I lose my health insurance, my cancer treatment will stop. I would like to know what my best option is. Thank you, Toni. Cindy from Lubbock, Texas. So, Toni, someone reaching out to you, which you ask them to do all the time before they make a decision, so you can give them the best information possible for their circumstance.
Well, the best thing that Cindy had was her mother to tell her to contact me, because if she had gone and signed up for Social Security disability, she would have lost her Medicaid. And Cindy is going to MD Anderson. You know MD Anderson, Jim, because you and I both live in the Houston area. It's not cheap, but it is one of the best cancer centers there is around. And she's not having to pay anything to get the treatment. She can get anything she wants. And as soon as she would sign up for Social Security disability, she'd lose Medicaid. That means she's going to lose her life and have the extra stress and make her mother not a happy camper. So, you've got to realize there's rules. They go by rules. That's how they keep it, so that not everybody gets something. And she made it. She got qualified for Medicaid. Medicaid's paying for her cancer. She needs to wait until she is totally clean, totally doesn't have any health issues, then go get on Social Security disability. But let's just say that doesn't happen. And we've got the other part to that. And let's say she can't get on Social Security disability because she's still sick. When she turns 65, she can get on Medicare, and you and I can discuss that after we have our little break, don't you think?
We can. This is Medicare Moments with your host, Toni King. We thank you for joining us, and we want to remind you to let your friends know about this exciting podcast that's new every Wednesday. Every Wednesday, there's a new edition of Medicare Moments with Toni King. You can reach out to Toni, 832-519-8664, 832-519-8664. Have a question? Email her to info@tonisays.com. That's info@tonisays.com. We'll be back right after this short break. Don't go away.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier. And my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And welcome back to Medicare Moments with your host, Toni King. We're talking about low income, qualifying someone for Medicaid, what to do, what not to do, so you can get the best healthcare treatment for yourself. And Toni, you say that if you make just $1 too much, you're disqualified from Medicaid. Is that true?
That is true. And each state has their own rules. So you need to find out what your state's rules are. Now, Texas is different than Oklahoma, different than California, different than New York. But Medicaid is Medicaid. That's just a whole different situation. That's for people that are low income and they can get on Medicaid. She qualified. I mean, she's not having to pay for health insurance. She's getting all the best care she can get. Now, when she turns 65, she can enroll, because she's not on Medicare yet. She can enroll in her Medicare plan, get Part A and get Part B, and qualify for a Medicare supplement. Then she can start getting her Social Security check and start getting that extra money. And she'll be able to get a Medicare supplement and not have to answer one health question. She can continue with the health care that she's got right now, but get a Medicare supplement. But, a lot of people want to get Advantage plans because they want that gym membership, and It may not work. You've got to sit down, talk to your doctor, find out what's best for you, not what's best for that person that's calling you. When someone is turning 65 and getting on Medicare, they get so many phone calls, they don't even know what to do. People are just calling them left and right, and they make you feel guilty if you don't talk to them. If you don't feel comfortable with the person on the other end of the phone, hang up. If I don't know who's calling me on a phone call, I won't answer it at all. So people need to realize we're being scammed big time.
So, Toni, what's your advice for her and Social Security disability?
Well, my advice for her with Social Security disability was that if she gets well and they give her a clean bill of health, then she can qualify for Social Security disability under 65. When she turns 65, she can get on Medicare. She can get her Social Security check. There's a whole ballgame. When we do a consultation, we sit down with you and we go through everything. When she called me, and this is a true story, and I sat down with her, we went through this, the whole situation. That's how important it is. There are organizations that help you get qualified for Medicaid and help you get the cancer treatment you need. So you just, your friends can be your friend when you need somebody, but don't take all their advice because they don't know everything, even though they think they do.
And America's Medicare coach, Toni King, is standing by to help you. And again, you can call that number, 832-519-8664, 832-519-8664. Go to Toni's website, tonisays.com, or you can email her info@tonisays.com, tonisays.com. So, Toni, thanks for this great information. And thanks, folks, for joining us for another edition of Medicare Moments. Toni, back to you.
And they need to remember, you do not get a second chance with Medicare. If you make a mistake, you can't go back and clean it up. That's just the way it goes. So make sure you take your time and do what's best for you. Talk to your doctor, give us a call, whatever works for you.
That's right. And like Tony says, with Medicare, what you don't know can hurt you. Right, Tony?
It can't hurt you. It will hurt you.
Thanks, Tony. We'll talk to you again.
Okay. See ya.
Attention seniors. Are you looking for a community that offers incredible benefits and stands up for your values? Look no further than AMAC. With an AMAC membership, you'll enjoy exclusive discounts on insurance, travel, dining, and shopping. Stay informed with 6 issues a year of our award-winning AMAC magazine, delivering trusted news and valuable insights. But that's not all. AMAC is committed to defending America's future by directly bringing the voices of our more than 2 million members to our elected officials. Join a community that cares about your needs and your values. For a limited time, we're offering a 1-year membership for only $1. Yes, just $1 for a year of incredible benefits and advocacy. Don't wait. Take advantage of this special offer and join AMAC today. Visit amac.us/join now. That's amac.us/join now.